Well, we are seeing COVID-19 numbers really fluctuate from day to day recently. Despite the numbers, though, health experts are still stressing people need to do their part to prevent the virus from spreading. Dr. Marcus Blackstone joining me right now. He's the Chief Clinical Officer at Bon Secours St. Francis Health System. Thanks so much, Dr. Blackstone, for joining me this afternoon. And we see these numbers kind of jump. We're now seeing them less than 1,000. But what do you want to tell folks who might see this as, okay, it's starting to go away?
So, as the numbers go down, we're seeing the same thing in our hospital setting. And, we think this is a direct result of people wearing masks, when they're not in home and social distancing. So we just, we're continuing to encourage people to social distance as well, wear the mask. And where we're still seeing some spread is in group gatherings. So when people get together in a group, we're still seeing, when we do the contact tracing, that's where we're seeing this track back to.
And Dr. Blackstone, this just coming out from Furman University. I just want to bring this up because you make a very good point about people not being in groups. A fraternity there has actually been suspended. They had some parties, apparently, according to Furman, on Friday and Saturday. They have 53 students quarantined, and they have 8 positive cases. And is this something you guys were worried about as, school's coming back, these colleges are coming back, that, maybe the younger generation really not taking this thing as serious as they should, and maybe having some of these parties is what we're seeing from Furman releasing about this party there off campus, but it's still, involving a lot of students.
Yeah, the concern is really with colleges. With K through 12, there was a plan, to make sure that all the precautions are in place. But, with colleges, it's a lot harder, as you just stated. So that has been our concern all along, as a group gatherings really in the college setting.
What about testing, Dr. Blackstone? Are fewer people being tested? We see all of these things, of course, people on social media saying this and that, but what do you want to tell people? Get the record straight out there, fewer testing, less numbers. What can you kind of clarify on all of that?
So you see the community testing going down. Part of this is you had a lot of community testing to hotspots as well, trends and positive cases. And then, DHEC really did, their part in, contract tracing to make sure that these areas were addressed, make sure they had supplies, they did the education. So you've seen the direct result of that as cases go down. So in the hospital, our testing cases really aren't going down from the standpoint, we still test anybody who has either contact or has symptoms, or is high risk for COVID from that standpoint and has symptoms. So we still test the same way, but the community testing has gone down. The other piece of that is the CDC went from a testing strategy to the middle of July, they flipped to a symptom-based strategy. So naturally that will decrease some of your testing. And I think we're seeing the result of that as well.
And Dr. Blackstone, are you concerned? We're heading into the fall pretty soon. We have the flu, which kind of peaks around that time. What do you want to tell people as we head out of summer and into the fall?
So yeah, we're concerned from a bed capacity standpoint. We usually get really busy during the flu season anyway, and then you layer the COVID on top of that. But what we hope is people will continue, to do the mask and wash their hands, social distance. Those will all help with the spread of the flu. So we're hoping, since this is all in place, we're hoping people will continue to be diligent and not let up. And so we hope that will help us control the flu season as well.
Well, Dr. Blackstone, I know you're a very busy guy, and I really appreciate you taking some time out this afternoon and talking to us here on the 5 o'clock news.
Absolutely. Thanks for asking.
Stay safe.